Naresh Kumar. I am working as interventional cardiologist in Amar Hospital, Mohali. In this hospital, we are doing all kind of cardiology services, which includes OPD, IPD, ICU, echo, TMT, Holter, angiography, angioplasty, pacemakers or AICDs 24/7. So today we are here to talk about cardiac disease. In this month, World Heart Day organizes World Heart Day, which is generally 29th of September every year. In this day, we educate and make our patients aware of diagnosis of heart disease, risk factors for heart disease, and how to prevent heart disease. So today we'll be talking about what are all the common risk factors for heart disease. Risk factors for heart disease are mainly divided into two parts. One is modifiable risk factors, other is non-modifiable risk factors. Non-modifiable risk factors includes age, gender or family history, which means genetic factors. So we cannot modify these factors, so we cannot change. So we will not be talking in detail about these factors. We will be talking about the factors which are modifiable, which means if we diagnose those risk factors timely, you can very well diagnose cardiac disease timely or prevent heart disease from occurring. In the risk factor, the most common or the most dreaded is diabetes. Diabetes, commonly known as blood sugars. It is diagnosed by checking blood sugar levels in your blood. There are two parameters with which you can diagnose diabetes. One is your fasting blood glucose level, postprandial glucose level, or a new test called glycosylated hemoglobin level. Any of these tests can be used to diagnose blood sugars or diabetes. There are various things which we can do to treat diabetes, which includes diet and physical activity, drug therapy, which means oral drugs or insulin. How diabetes is related to cardiac disease. Diabetes is one of the most common risk factor for heart attack in our country. It is almost called as equivalent of heart disease. Whosoever is suffering from diabetes, we practically consider them as suffering from heart disease. This is one of the most common cause of silent ischemia, we call it as silent heart attack or silent MI in these patients. What this means? This means patient does not have the routine cardiac symptoms which a normal patient has, that is chest pain or breathlessness. Patient just collapses, or when you go to any doctor, they do an ECG or echo and they say there is some problem in the ECG or some problem in the echo, and they will say you have suffered heart attack in past. So you should be very careful in diagnosing diabetes and treat it accordingly so that you can prevent heart disease from occurring. The problem with diabetes is there are two types of complications with diabetes. One is uncontrolled diabetes. Second is duration of diabetes. Most of the patients, they come to us, they say my sugars are well controlled. How can I get complications of diabetes? See, one of the complications are because of the high sugars. The other complications are duration of diabetes. What this means? This means if a patient who is having blood sugar levels which is within normal and is a diabetic, but he is suffering from diabetes for past 10 years, another person 20 years, 30 years, etc. So the person who is having diabetes for a longer duration is invariably at risk for getting any of the complication of diabetes, which includes brain stroke, heart attacks, kidney disease, peripheral arterial disease, or small vessel disease in the eyes. So you should be very careful in controlling diabetes. Next risk factor is hypertension, which we call it as raised blood pressure. So most of the time patient is always having a misconception that that day I had something, that day I had some stress, so only that day my blood pressure is high. This is not the case. So if you check blood pressure on multiple times and it is coming high, say more than 130 or 80, you should take appropriate steps to control blood pressure. Same way you can do it by doing good healthy diet or physical activity and pharmacological therapy which your doctor prescribes. So what hypertension causes to the heart disease? Some people have misconception that in heart attack you cannot have high BP, or in heart attack you cannot have low BP, or in heart attack you cannot have normal BP. So there is nothing like that. In cardiac disease you can have any of the blood pressure. It may be high, it may be normal, or it may be low. So you cannot say my blood pressure is normal, I cannot have heart attack. To diagnose blood pressure timely and control it so that your propensity to develop cardiac disease is reduced. So we are all aware of there is something called good cholesterol, which is HDL, high density lipoproteins, or there is something called bad cholesterol, which is LDL, that is low density lipoproteins. So 80% of the cholesterol is formed in the body, 20% we take it from outside. Outside, whatever oily or junk food we take, they constitutes the cholesterol. If you do good physical activity, you form more of good cholesterol, that is HDL. If you take bad diet, you form more of bad cholesterol, that is LDL. So to prevent cardiac disease, you should have high HDL or good cholesterol, or as low LDL or bad cholesterol. Some people think that this is the value in which I should not get cardiac disease. Cardiac disease can come at any value of cholesterol. It doesn't mean that if you have LDL of less than 70 or less than 100, you cannot have a cardiac disease. It can happen. Next is the common risk factor is alcohol or illicit drug use. This is very important risk factor because whatever risk factor we have talked till now, that is diabetes, hypertension or dyslipidemia or cholesterol, they are generally risk factors in relatively older age groups, that is more than 40 or 50 years. But this risk factor is very prevalent even in the younger age group, and smoking is one of the common cause of young myocardial infarction, young heart attacks in the patients. So even if you don't smoke, somebody else is smoking and you are just sitting with them, that is also equally dangerous. And whether you smoke 1 cigarette or you smoke 10 cigarettes, that is also equally dangerous. You should not smoke. You should not sit with somebody who is smoking. Regarding alcohol, I can just say one line. Alcohol does not protect you from heart disease, whatever amount you take. There is always a misconception that if you take this much amount or this kind of alcohol, it prevents heart disease. It is not so. There are some other newer illicit drugs which are quite common nowadays. That is very common cause of young heart attacks. Most of the time, if a patient comes to us who is just 25 or 30, who do not have any diabetes, hypertension, cholesterol or family history, they are having either heavy smoking history or some other illicit drug abuse. So this is a kind of risk factor which is totally modifiable, which is in 100% of our control. So you should not consume any kind of these things so that you can prevent heart attack. Next is good physical activity. Most of the people, they ask, what kind of physical activity you do? Anybody who can do 30 to 40 minutes of brisk walking or jogging around 6 days in a week or around 300 days in a year, you can protect yourself from heart disease, or you can reduce one of the risk factors if you are doing good physical activity. Heavy weight training, some people say we do heavy weight training, but it does not protect you against heart disease. Sometimes it is harmful. So if you want to do physical activity, you can just do light jogging, that sort of brisk walking. You can do any kind of yoga or any other light physical activity that will protect you against heart disease. Next important thing is diet. If you consume 100 grams of fresh fruits or fresh vegetables, that is very much help you in protecting against heart disease. Milk, generally if you want to consume, you can take half kg of double toned milk. Non-veg, generally you should avoid as much as possible. If you want to take, you can take some boiled fish, nothing else, no other kind of non-veg. It generally harms your heart. Now coming to the last and the most important risk factor, this is the psychosocial risk factors. This is very, very important in present era. If you have significant psychological stress, you are at risk of getting heart disease equivalent to a patient who is having any of these risk factors, that is diabetes, hypertension or cholesterol or smoking. What kind of psychological stress it means? Generally everybody is under stress nowadays. So if you lose your job or loss of spouse, this is considered as a very significant psychological risk factor, and this is a common cause of heart disease or heart attacks in young patients especially. We come across, just like I told earlier, patient is coming, young patient with heart attack, no major risk factors. So most of the time either they have strong family history or they are having smoking, alcohol or some kind of illicit drug use which they consume daily, or with the factor which we generally also overlook, they have significant psychological stress. So to avoid stress, you should try to talk to people, you should try to talk to your near and dear ones, try to talk to your relatives, try to talk to your friends at least 5 to 10 minutes in a day, so that you can prevent heart disease from occurring. Heart is an organ which is very healthy if you are happy. Now festival season is coming. You might have seen at lot of places people write it as hearty congratulations, because your heart is happy and healthy if you are happy. Nowhere it is written as brainy congratulations or kidney congratulations, because your heart is healthy if you are happy. So in the end, I would like to finish by saying, दिल खोल लो बैठ के यारों के साथ, वरना डॉक्टर खोलेंगे औजारों के साथ. Thank you.